Service and Arts Committee has invited the Cleveland Department of Public Health to provide an update on public health emergency preparedness in the city of, in our great city, the city of Cleveland. Something I want to show you.
Oh, great.
Take over this piece for you. I'll be right back down. Chair,
Yeah. Should we get started? You want to wait?
I just hit the gavel. You start right now.
Okay.
There's no legislation up. We're doing a hearing on emergency preparedness. I want to bring in Dr. David Margolian.
Okay. Well, how about we start with the panel introducing themselves?
My name is Liz Swoboda. I'm the chief
Microphone,
epidemiologist.
grab the microphone right there, or you can, here, you got your own right there.
That way you guys.
My name is Liz Swoboda. I'm the chief epidemiologist.
Oh, it'll make your life easier.
YouTubes can't hear you unless
Yeah.
the microphone. For all the
All right. Is this better? All right. My name is Liz Swoboda. I'm the chief epidemiologist at Cleveland Department of Public Health.
And I'm Tracy Pate, the Emergency Preparedness Coordinator for the Cleveland Department of Public Health. And may I introduce my staff, who is also here?
Yes, please.
I have joining me today Alexa Unitowski, who is my Deputy Emergency Preparedness Coordinator, and Natalia Maykrantz, did I get it right? Who is our Emergency Preparedness Specialist. This is her first week. Like, she made it 1 week and came back.
Wow. So one day at a time, as we say at the city.
And I am Dave Margolies, Director of Public Health, and honored to have these two colleagues to my right.
Excellent. Well, it sounds like we have a presentation that you'll be going through and that we have it up on the board for people to look at. So I'll welcome the panel to begin going through the presentation.
So yes, we have been invited today, the Health Department, to speak to our epidemiologic surveillance and emergency preparedness when it comes to infectious diseases. So with that, our Chief Epidemiologist, Liz Swoboda.
Thank you. I'd like to start just by giving an overview of the case investigation process for infectious disease and how they happen under normal daily circumstances. This is something that is our #1 focus. It is something that we are required to do by Ohio law. And like I said, we do this on a daily basis. So how this process usually gets started. Somebody is sick, they go to their healthcare provider, that healthcare provider runs tests, and let's say one of those tests comes back positive for a notifiable condition. Once that happens, we receive the result. That can happen a couple different ways. Usually, that's going to happen through the Ohio Disease Reporting System, or ODRS as we call it. This is set up by electronic lab reporting. So once that test comes back positive in a lab, it's automatically sent to the Ohio Department of Health. They verify, make sure it is an actual case, and then it gets uploaded into ODRS, where we are then notified of it. Sometimes, not so much anymore, we get these reports by fax or phone. By fax, it's usually coming from smaller community clinics who are not set up with electronic lab reporting, or in the case of a Class A reportable, which is going to be our most severe cases that are in need of most immediate attention, that's going to come by phone. That is also written into Ohio law that providers are required to notify the health department, meaning either CDPH or ODH, of the positive result for Class A. So once we receive that result, the investigation begins. This is something that a lot of people became familiar with during COVID. If you got COVID, you probably got a call from one of our temporary case investigators. So once we get that positive result, we start to gather our information. Depending on the disease, this can happen a couple different ways. Frequently, it involves an interview with the case to get information about where they may have gone, if it's a foodborne related illness, where they may have eaten, and any other exposures that they may have had that can help identify where they got sick. This is also where we get information about their contacts. So if it is a condition that we're concerned about transmission from person to person, there's some conditions where we can get prophylaxis from that. So we need to know who you saw, when you saw them, what the nature of that contact is, so we know if we then need to get them prophylaxis to keep them from getting sick. We also touch base with the provider if there's any other information that we need to get from them. And once we have all this information, we then decide on a course of public health action. So these actions can be a couple different things depending on the disease. The first two, again, are something that folks are very familiar with from COVID, isolation and quarantine. They're often used interchangeably. They're not actually the same thing in public health speak. Isolation is for people who are already sick to prevent them from spreading any further disease, and quarantine is for people who were contacts of the case who are not yet sick, but we want to wait and see if they do become sick. As I mentioned before, we can also make prophylaxis recommendations for any contacts. We also do infection control evaluations. This is most often in long-term care facilities or nursing facilities. We'll go in, just observe, shadow, and then make recommendations that can help reduce the number of healthcare-associated infections. For some foodborne illnesses, that requires follow-up testing before you can return to work, especially if you're a food handler. We can also make environmental referrals. Again, this is in the case of foodborne illness, where we'll send the list of potential exposures, meaning grocery stores or restaurants, over to our environmental health department to make a recommendation that they go out and do an investigation to see if this may have been the source of the illness. We can also do specimen testing. This is often, again, in terms of foodborne illness or potentially for any rabies, if we have an animal that we can test for rabies. And finally, sometimes it's just education. Sometimes we just need to educate people on how this disease spreads and how it can be prevented in the future. Now, as I said, this is something that we do on a day-to-day basis. This is very common for us to go through this. Now, in terms of emergency preparedness for something like COVID, or back when we had the Mpox emergency, we did the same thing, but just dialed up to 11. Of course, with COVID, we had a lot more case investigators coming in, going through this investigation process, and we were, it was a lot more urgent than it would be on a normal basis. So with that, I will turn it over to Tracy for a description of emergency preparedness.
Just forward it, because I think I only have
There we
one
go.
side. So I'm the doom and gloom portion of our presentation this morning. So we work very closely with Liz's office and all the epidemiologists, but we do consider more than just infectious diseases. So like Liz mentioned, there's COVID. We all know about COVID. There were vaccination clinics. There were testing sites. We could open flu clinics. In the case of bioterrorism, we may open a pod to get prophylaxis to the residents to combat that agent they've been exposed to. But we've really taken all hazards approach to emergency preparedness. We don't just look at diseases because we're in the health department. We look at other things that impact the public's health. And one of the examples I'm going to use is high heat. We all know it was hot this summer. We all know we had a lot of discussions about cooling centers, although we're not allowed to call them cooling centers. They're just rec centers that happen to have air conditioning. So one of the things that Liz and I have been working on, and this is a really good example of a public health approach to an emergency, is I went to Liz and I said, hey, you have epicenter data. Can you tell us how many people sought treatment during this span of time in these zip codes, look for these zip codes for heat-related illness? And as a result, we can kind of get a picture of where the people who needed the help were, who didn't go to the cooling center, they went to the emergency department. So information like this can help inform, number one, where we open cooling centers, and then in the long term, it can help us make decisions like of a capital nature, which are way above my pay grade, about which rec centers may need to be larger, completely air conditioned, and have generator backup power, so that no matter what, we have heat or cooling for those residents. So that's really, we think of everything, guys. We really do.
So, doctor, how do you evaluate it? Here's an example. COVID is on the rise again. It's not on the rise. It's going down. Okay, and that's good. But I hear on TV, when I watch CNN, they talk about COVID is on the rise, And I said, well, let me bring the doc in so we could do prevention. So tell me about some diseases that that you see that might be a spike, and how do we do prevention, and how do you let residents know in the city of Cleveland to prepare themselves, and how do we create a warning, some kind of warning system in place to let us know?
Through the chair, I'll start with my team if they want to start with just speak to the current state of respiratory viral illnesses.
Sure,
and
I
things
can
like-
discuss COVID. And we do have an updated brief that we can share with you all too, to kind of see the patterns over the past 18 months. So as you said, there was a little bit of an increase of COVID over the summer. This is actually normal for this time of year. I like to encourage folks to think of COVID at this point how you would think of influenza. It can be very serious. For most people, it's not going to be very serious. We're going to see rises and falls throughout the year, and we have started to see similar patterns across the 4 years of COVID. So throughout late summer into early fall, every single year so far, we've seen an increase. So an increase on its own is not anything to be extremely concerned about. The good news is that COVID hospitalizations are still extremely low. The number of people who are getting admitted to the hospital because of COVID is very, very low. And I mean, we're talking one person a month, maybe.
Real low, that's a good
Yeah,
thing.
very, very low. The same with emergency department visits. Although there's still people going to the emergency room for COVID-related reasons, most often shortness of breath, this is also very, very low. And I mean fewer than 20 people per day during that high peak. So while COVID is out there, and it is something to be wary of, it's still important to take those precautions to keep it from spreading. For most people, it's not going to have severe outcomes.
So, because I was thinking about, matter of fact, next week I go to UH, University Hospital, and I'm looking to do my flu shot, and as well as my COVID shot to do prevention. I've been blessed, I didn't have it, but I was out there in the middle of it, walking door to door, seeing, giving my residents resources, what they might need. You guys, we would try to put systems in place to get them to Case Western Reserve, because that's where we did the shots at, the COVID shots, I took one of the first ones to get the COVID shot, because in the African-American community, we were leery of dealing with the shot, so I took the shot first, and I was just hoping a brother wouldn't hit, But I had to, because you had to show leadership. Have you thought about creating an early warning, some kind of system that when you have Ebola or COVID or some diseases coming in, we have an early warning so we can tell the residents which direction to go?
Yeah, through the chair, I'll defer to Tracy. Do you want to talk through some of that, whatever you can tell without breaking confidentiality, kind of some
Yes.
of our early warning systems?
So we do have the BioWatch system, which I'm sure, have you all heard the term BioWatch?
Yeah.
Okay, so BioWatch is an air sampling program that is run through the Department of Homeland Security, and Cleveland is fortunate enough to be one of the cities that has that program. They're called portable sampling units, and they have a special filter in them, and they're put out every day and collected every day. They are looking for things that can be weaponized. I can't list the agents, but I will tell you one is anthrax, because Netflix already did. So that is one of them. So with that portable sampling unit, that filter gets pulled every morning, and it goes to the state lab at ODH. It gets tested, and we know exactly what's on that filter by about 1:30, 2 o'clock in the afternoon.
That's good.
So it's 24-hour monitoring. There are 30 locations that monitor that all across the city. Also, can't tell you those. But we have a very robust notification system. Like if something happens and it's even a bit squirrely, no pun intended, because squirrels can sometimes set that off with something called tularemia, also known as rabbit fever. But it gives us the time to convene a call and say, okay, do we have a weird thing where a squirrel ran into the filter, or somebody hit it with a lawnmower, or do we have like an actual bioterrorism event? And that creates an entire convergence of state, federal, and local partners that talk through the whole scenario, and then we say, do we have an actionable public health emergency right here? And that when we talk about federal partners, we're talking about like everyone, like you name the alphabet, and we got them. Yeah. So, and that has played out in real life, even though it was a false alarm. We got Epicenter, very reliable, gave us a result, and someone acted on it and called the hospital and said, hey, we got this, and maybe it's anthrax. It was not anthrax, but we still have to go through that notification process, right? So I call Dr. Margolius. Dr. Margolius and I talk about it. I wake up the FBI agent. We never rest. I mean, we are always watching out for the citizens. And if you'd like to know more about the BioWatch program, we can get our connection at DHS. Her name is Ebony Lampkins. She also used to be a Cleveland Department of Public Health employee. She was an epidemiologist. She'd be happy to come in and do BioWatch 101 for council if that's something that they're interested in. She goes very high level over the program, but it might give you a little bit of peace of mind and some information to share with your constituents.
Yeah, I think when that contract comes up for review, that tends to be the time that we talk about it.
Okay.
So, Doc, are you working with, when you look at this to prevention and you create an early warning system, there's risk, and you do a risk analysis where are the risks at. And we have certain departments like EMS, the fire department, as well as public utilities with the water. Is there systems connected to that? Because if the water is not, if there's issues there dealing with bio, we connect so we know the risk, and then you can also connect already to the residents to tell them about issues and concerns.
Through the chair, absolutely. So anytime there is a threat of emergency, we stand up our emergency operations center, bring all the right stakeholders together. Communications is a big part of that coordination and that program. And so all those factors are considered as we're working through whatever the challenge is.
But to the fire department, are we working with the fire department? Because sometimes they might have a bio threat. You mentioned bio threat, a train like we had. Remember you were talking about the trains a year or two ago. Was that a year, maybe 2 years ago? Yeah, trains. We have trains just traveling through the city of Cleveland. The train flip over, whatever the case may be, maybe some bio chemicals on the train. Fire department go out there also. Got to let the residents know what's going on. You got to have systems in place so we know what's going on, so we can protect the residents of the city of Cleveland.
Through the chair, Tracy will describe one of our exercises that involve all the different departments and walk you through that coordination that happens.
So I know you're talking about East Palestine.
Right,
Palestine?
yeah,
Palestine. Okay, so since that happened, there's been like 3 other train derailments. But we're all talking about that one still. And we actually are very fortunate in this region that the city of Cleveland has 2 Type 1 hazmat teams that are ready to go. Like, they get the call, they're out the door. In addition to that, there are 4 Type 1. Type 1 is the best. They're like the rock star hazmat teams. We have 4 of those in Cuyahoga County. We have a mutual aid agreement with them. The commander of those teams are all fire chiefs, very well seasoned, very well trained. They go to Anniston, Alabama, and get specific training on not only biohazards, but chemicals that can come off of a train. They're very familiar with the placards on the trains that pass through here. And then we have something called the Local Emergency Planning Committee, Local Emergency Planning Committee. And that's something that's run through Cuyahoga County and the city of Cleveland. And they do nothing but talk about chemicals and all the bad things that can happen in the city of Cleveland with chemicals.
That's very good. And you're working, as you mentioned, with the fire department. And it's something that I put together. I never put my stuff down. I just, but let me say this before I show it to you. We have it's a reverse 911 that we call people in case of emergencies, with reverse 911.
Yeah.
We can reach out if there's a dirty bomb attack, if there's, we had tornadoes that came to the city, if there's a hazardous issue, do reverse 911. Some of the residents don't know what that is, and with emergency preparedness, they gotta know, and we have to work with them. So, I know that the Department of Aging use it for care calls, but it's the same system.
Code Red. Code
Correct.
Red, yes. Code Red is something, it's a little tricky because you have to get the residents to opt in, obviously. So it needs a bit of an advertising campaign, which would be fantastic for the Mayor's Office of Communications to get behind, especially with winter coming.
Right.
So if you could jot that down, if you want to pass that one on. We could use some help promoting Code Red. Now, it does have that reverse 911 capability where it can reach out to a resident and the resident has to click one to respond, so we know that if they have not received the message, we can print a report and we can say this whole area hasn't received a message, and maybe that's a problem with the system. Now, we also have in conjunction
I
with
got you. I understand.
you make me very nervous.
No,
I'm just going to be
I understand.
like, this is like the Spanish Inquisition here.
I understand. My focus is not on that. Yeah. You're great. You're fine.
All right, thank you. My mother will like hearing that because I'm
Yes.
pretty sure she's watching.
Is she watching?
Yeah.
Tell moms you cool beans. I always say cool beans. Cool
Okay.
beans.
All right. Thank you. So we do also work in conjunction with Cuyahoga County Office of Emergency Management, who has a similar program that's called Ready Notify. Theirs is a little more well-known because it has a lot more advertising behind it. So if we could model that type of PR, that would be fantastic.
Did you write that down? Was ready, well known. I'm gonna take a look at it. We'll look
Yeah.
at lessons learned.
Code Red, the problem with Code Red, it is very cumbersome to use. There's a lot of different ways to send out messages, and the way the Department of Aging uses it is very, they set it up and it goes every day. In an emergency situation, it's going to take us 15, 20 minutes to figure out how to use that system. And by then, the tornado is already on the ground. So one of the things that I would advocate for is jumping over to the county system. It's easier to use, a lot more intuitive. But that's not the purpose of this hearing, I realize.
No,
But,
I need that, because I was looking at that.
I mean, I live in worst-case scenario land, and 15 minutes is a big deal when you're talking about a tornado or when you're talking about a biological weapons attack. So as far as notification and warning, we need to get the information to our residents that this is where you look for information. Watch the news. Don't watch social media. Here are the apps you can put on your phone if you have a cell phone. There are very specific apps from the National Weather Service where you can drill right down to your own zip code, and it'll put a polygon right over your house. It'll tell you if there's a tornado coming to your house. I've seen that in action.
Wow.
So,
We need to take a look at that. That's what I'm talking about.
I mean-
Do we have that at the county?
everyone can have it. It's free.
We have to show people how to use it. They
Yeah.
have to show me how to use it, because that's what I'm talking about, is prevention.
Absolutely.
Prevention is the key.
Yes, that's really what we need. Code Red, while very well intentioned, I've seen it used by the police department to say, hey, we got a bunch of overtime shifts, who can fill them? Those kind of things. It is used internally for call outs, but a lot of the information is available for free in a much less complicated way for our residents than Code Red, which might take us a lot longer. And these, they can sign up for automatically. There is no lead time of us developing a message, which
So-
is crucial.
So how do we get that out to the residents to help them? We might could put it in newsletters.
Sure.
Who could write that up, Director?
Through the chair, we could put something together for you and send it to the body, and then we'll work on promoting it to the community as well.
Yeah, because that would help us. So I'll talk, of course, I talk with the county every day.
Every day.
Every day, I just had a debriefing from the county. You know what I'm saying? So I'll talk with my wife about it and with that other system there. And then we could also share and tell the residents, because what I'm afraid of also, you know how we had the tornadoes
Yeah.
this summer? It was in the summer. But if you have a blizzard, real bad blizzard, like we did in 1978, you weren't around. No, and you weren't around?
I was a baby, and I hear stories about it constantly.
Oh, God.
Everybody had to let me know how they had to
I was around.
shovel out of
You
the
were
front
around?
door to get formula.
I was 3, but I was around.
Oh, man, I lived in 78. It was almost as tall. It was almost as tall as I am.
6 feet of snow.
There you go. There you go.
All I
Everybody.
know is that my grandfather spent a lot of time in a beer garden in Slavic Village.
So you see the warning. You know, there's a probability. I'm not saying it's coming, and I don't know the numbers of the probability, but it's lessons learned. We have to try our best to be prepared. So get it out there. How to use it on the phones about tornadoes if it's coming to your house. I'll talk with my wife about the county piece. You got to write that down for me some more and then hand it to me, and then I'll ask her about it. And
Okay.
then we could meet with Chris Ronayne, and then I'll reach out to the mayor. I already got systems in my mind what to do.
So you want more information about the county's notification system?
But if you tell me the county notification system, I'll just ask at
Okay.
home. I'll go home and ask my wife about it, and she'll
Okay.
get me in touch with some people.
Okay,
And we could do that. But you mentioned something earlier about Code Red, how it's cumbersome, and
it is very cumbersome.
yeah, we got to put systems in place. We have to protect the residents.
There are easier, more intuitive systems, and I know that
Right.
the county, or the city spends a lot of money on Code Red.
Yeah, we do.
And honestly, I worked here in 2014. I left, I came back, he calls me a boomerang.
Grass isn't greener.
On the
I
other side.
really.
Don't let the green grass fool you.
Yeah, believe me, sir, I am aware. But I was very disappointed to see that Code Red was still here.
You weren't.
Yes, because honestly, I went to Florida and was trained on it and still couldn't use it. Like, went to the developer and had training, and I was like, this is,
You know, it was this councilman. Yeah, he telling you it was this councilman that brought back from the National League of Cities around 2010.
are you responsible for Code Red?
Yes, I am responsible for Code Red.
Shame on
As
you.
well as 311. As well as, that's right. It's developed. Thank you. Help me out. Help me out.
The
Now,
concept
in-
was right through the chair. The concept,
In-
right idea.
it-
Just hasn't kept up.
In
You're
your
good.
defense, sir, it has been bought and sold several times since.
Oh, wow.
Yes.
Corporate America strikes again.
Capitalism.
America. Yes, yes, yes.
So, I mean, I'll give
Yes.
you a little bit of a slide there.
Thank
But
you. You beat up the councilman. You beat him up. Yeah, I'm about that. As
you
well as
probably shouldn't have
311,
brought me.
the dual phone system with 311. And, you know, I'm proud of those two pieces there of legislation. But not to get caught up in the ego, I'll talk with my wife about the notification system.
I think 311 is fantastic, and I think we don't promote 211 enough either.
Yeah, we don't. We need to, especially with the poverty that we have, and we need to take advantage of the resources. And that 211 is good and is great.
And that is, now, when the tornadoes happened, and I'm going to shine a light on him a little bit here, we needed to have a very quick meeting of social service partners, people who helped with the food bank, people helped with SNAP benefits. We did have 211. 211 gets a lot of calls about unmet needs. People had questions about, do I need to refrigerate my medicine? Then, of course, there's the ever popular one, is the power coming back on? But Dr. Margolius was able to use his contacts to pull together this huddle where we said, you're doing this, I can help you with that, I can help you with that, we can pitch in here. And that kind of quick touch base is the kind of thing that needs to happen when there's an emergency. And we're able, because preparedness is built right into our name, able to be a little more proactive in our approaches to disasters.
That's good. You know, Dr. Margolius, you talk about me texting early in the morning. I text him sometime at 2 and 3 o'clock in the morning. I'm gonna have some issues. Isn't that true?
That's true.
It'll be 2 or 3 o'clock in the morning. Then I text when you mention it to the missus, like, that's what Kevin, I could wake up, by me being an artist, a musician, sometimes I could wake up in the morning and think about music as well as legislation, because they're both creative. And if I have something on my mind, then I get to writing and texting 2 or 3 o'clock in the morning. Then I turn back over and go to sleep because I got it off my mind. And the same thing with music. I have an electronic drum set now, so I won't wake up everyone in the house or the neighborhood, because I'm a jazz drummer. I get up in the morning.
Jazz drummer,
Yeah, and
excellent.
practice sometime 3 or 4 o'clock in the morning. The drums, whatever the case may be. I almost got thrown out of a hotel in Los Angeles.
But the point of the electronic kit is that it has a volume knob.
I got the
And you can
electronic
turn the
kit
volume
now.
knob down, so
Yeah, I
you
got
don't
it
wake
now.
everybody up.
I got an electronic kit now. Some kind of way I got it this
But
year.
that doesn't wake people up.
I know.
But you turn it up.
I have it now, man. I have it.
And your
I got to.
and your favorite jazz drummer, sir?
I like Art Blakey. I like Miles. Not Miles Davis, but in the trumpet, you can use the trumpet charts to play drums also. I like Buddy Rich also. Buddy Rich, bad dude. Bad dude meaning good.
Yeah.
Meaning good. We're talking music, we talk.
Yeah.
Yeah, so, yeah, he is famously bad. He's very, very good. So I like that kind of stuff. I wake up in the middle of the
Yeah.
night just thinking, and my colleagues know I start texting, don't I? They say, Kevin, up at 2 o'clock and 3 o'clock in the morning. It's on my mind. I got my rest. And then I just wake up everybody, just start texting, thinking about stuff.
Have you seen the movie Whiplash?
Yeah, it's cool. I watched it, but it's a movie.
It's intense. It's totally intense. You got to watch it again.
Yeah, it's intense. It's very, very intense. It's
Yes.
very intense. So
recommend it.
so I do want to do that, and we'll talk with the mayor. We'll look at the notification system. I'm glad you brought that up. We truly, truly care as council members, and we think about people think we just think about our wards, but we think about the entire city, people that live,
Right.
work, and travel through the city of Cleveland.
Correct.
How do we make that better for Cleveland? And if that notification system could help and to save lives for Clevelanders, that's really, really good. That's cool beans. And we'll reach over there together, Dr. David Margolius and I, and we'll pay them a visit. For this winter, I want us to be stronger. Looking at lessons learned from the 2 hurricanes that hit that, and not hurricanes, can't hurricanes, but tornadoes that hit
Right.
that.
I think we could benefit from being a little more forward-leaning when we see weather events coming.
Right.
I think there could be more conversation. I know no weather forecast is 100% confidence, but some discussion is better than no discussion when you're
Right.
talking about preparedness actions. We could start doing that in the winter. I definitely think it's necessary in the summer. And I definitely think the health department should be leading those discussions. I understand that the implications impact the rec centers in their budget.
Right.
But I really think that when it comes to protective measures for our residents, that public health should be at the table for those discussions.
Well, you could do this with the rec centers as well as with the health department. You could, 2 things. The weather person is really looking at the history like they'll say 1984, this happened or that happened, and then you'll see a trend. So you go back and say, okay, this is the same trend that we noticed in 1990. So the odds or the probability this is going to happen.
Right.
Because that's all she's looking at or he looking at is history. They do
Right.
a histogram.
And I'm looking
And
at
so-
5 different apps that are telling me Armageddon is coming in the form of snow. And
Right.
I think there's got to be a balance between that look past at the past events and then the potential for what's coming, because it is more severe than it used to be, just like the tornadoes, more severe than they used to be, and later in the year.
Yeah, because we lessons learned. So, and I'm going to yield to my colleagues. Dr. David Mongolius, I'll do a sidebar with him.
Okay.
You're the expert, I'm not, but I can open up the avenues.
I can teach you.
Okay, good. With the city and the county, I'll sit back and listen. You'll give me things, and then we'll start planning for it.
Okay.
Colleagues.
I just had a question. Mr. Chair, thank you. So back to weather, because it seems like I saw once that Cleveland used to average over 100 inches of snow every year. And famously in the 70s and 80s, we did. But with climate change and everything else kicking in, or maybe just normal patterns, changes in patterns, it seems like we've had a lot less snow in the recent years. And some years, I think we got away with like 12 to 15 inches one winter, which was kind of shocking. How much of an impact does weather patterns have on disease and spread of disease and the problems with, I mean, is a mild winter bad for disease because everybody's got that 33 degrees temperature and they're outside, but there's no snow, but
Depending
there's,
on it,
you know what I mean, what's the relationship between changing weather patterns and the spread of disease?
Sure. So yes, short answer, it does have an impact, particularly when we think about our vector-borne diseases. So that's going to be things that are spread by ticks and mosquitoes. Because it's not getting as cold as it used to, those vectors are not dying off in the same way that they used to. So they are reproducing more and increasing the risk of spreading those diseases.
How long, great point, through the chair, how long does it need to be sub-zero to kill off these? I hear that all the time too, that you need to kill off these animals and that the spotted lanternfly could very well die over winter, but if we don't get colder, how long does it need to be sub-zero to kill these things?
That I don't have an answer for, but we can find out for you.
Uh-oh.
Yeah.
It's 3 frosts. I used to work in
There you
an
go.
What does that mean, I know what a frost is,
You
what
have
does
to
it
have
mean?
3 hard frosts to kill fleas and ticks.
Consecutively, like in a row, like
72
all
hours.
3
Yeah.
days?
Well, over like a week's time, 3 hard frosts. And that's, a veterinarian told me that. So there you go. I used to work in an animal
That's fair,
hospital.
that's fair.
I also have a lot of dogs, so I'm very concerned about fleas and ticks.
Yeah,
3 hard frosts.
3 hard frosts. So 3 days sub-zero. I mean, a hard
72
frost, frost is just when the air temperature dips while there's still a lot of precipitation in the,
Yeah, but that crunchy stuff that gets on the grass kills them, kills the fleas and kills the
right.
ticks.
But after too many days of sub-zero, the moisture in the air is pretty much gone anyway, so you don't get a frost.
Yes, but you have killed the fleas and ticks.
If you've killed them,
and-
they're dead.
yeah,
Right,
and
right.
their larvae.
And their larvae. Yeah. That's
I
awesome.
was wondering that's a great question. We talk about that all the time.
We need freezing, we need cold, we need snow. Snow's important.
Oh, snow is very important.
Yeah. And, Mr. Chair, once I read that of all the land mass on Earth, which is what, 25% of the Earth, I think, is land, only 10% of the land mass is situated in a region that can get all 4 seasons. The other 90% of land mass is either equatorial or cold all the time. Whatever the opposite of equatorial is. Polar? I suppose polar? Oh my God. Anyway, we're very fortunate to live in a region of Earth where it has 4 seasons. So,
Right, Alaska.
beautiful
Greenland,
Ohio.
North Pole. Greenland gets spring.
I think they have a thaw.
Yeah,
I don't think they have a summer. I don't think they have a hot summer though. They have a thaw.
but down in Ecuador, it's hot all the time.
That's the equator, yeah.
Right.
And most people live near the equator. That's like the most common place to live, right? Because it's warm, right?
Doc, with the, oh. Are you?
Yeah, it's okay.
You want to
Okay,
go? Yeah, go
okay,
real
I can
quick.
finish. Doc,
Sir.
with the health department, in some cities, health and safety, they're directly correlated. And when they have community meetings, for example, the 5th district, 3rd district, whatever, the health department is there. That way, we can have an up-close view with the residents about diseases, whatever the case may be. And even right now, we have our safety celebrations with the police department, but we don't have you guys included in there. And why don't we have that kind of relationship? Because here's an example. Healthy and safety, they're integrated, they're one and the same. Even with the police, it can integrate into the fire department as well as into health can integrate into the police department, whatever the case may be. And we don't have a presence at these community meetings.
Through the chair, per your suggestion, we're regularly at the safety district meetings, talking about different health issues.
We're there now.
Oh, yeah. And we even created a position that, through this body that intersects safety and public health. And that's her full-time job, to work on the intersection between safety and health. So absolutely, we
So there's the
routinely do
5th
that.
district and so we'll go there together. You and I, we're very good friends.
Anytime.
So we'll go there together. I mean, I believe you. I just want to,
Yeah, sure.
because the health issues come up
Sure.
and it could do prevention.
Absolutely.
All right. It's this, yes, Councilor.
Thank you, Chair. Just have a question to, your name again?
Liz.
Liz, Chair to Liz. I just needed the breakdown of the, what is OEPH?
The Office of Epidemiology and Population Health.
Say it again.
The Office of Epidemiology and Population Health. So that is myself, 3 epidemiologists, and a disease surveillance specialist.
Okay. And also, you have here unusual via ODRS. What does that mean?
That's the Ohio Disease Reporting System. So that is the statewide system where all notifiable infectious diseases are sent.
Okay. All right. Thank you. Thank you, Chair.
Doctor, when I hand this out to you, something that I designed.
Yeah.
And I just want to explain it. I'm not the expert, and I want you to take a look at it, because here's the thing. I think,
You got it. You got the right angle.
yeah, you have the
Am I
right
doing it
angle.
All right,
Yeah,
good.
you're good.
Something simple
Make it look so easy on TV.
need to be given to the residents. Here's an example. Even with EMS, we don't have, in some of the houses, there's no addresses. And so EMS is just going around in circles
problem.
a little bit, big problem. But if you were able to put help on the window, the EMS will be able to look and say, there's a help sign right there. I believe in time management, and it's something simple. It's similar to an SOS. You put this up, they say, oh, there's a help sign in the window. And we can get there quickly. And I believe, if I'm not writing policy, that I'm writing something with a framework to give to the experts so that you can look at it and be able to say, Kev, this is simple, because you don't even be able to think about it, but it's handy and it's right there. And the other thing that I was looking at to my colleagues is that, let's say, for example, you had a tornado and, let's say, Pierpont, 50 houses is there. We train the residents, and out of the 50, the emergency preparedness team drives down Pierpont. And they see 10 people with 10 houses with help. Then with time management, you would know to go to the 10 houses first. But the other homes have okay or they have nothing in it, but you'll go to that. But it teaches you how to think systematically, and it's like an SOS.
Sure.
Is someone on an island or not? So you wake up in the morning, you think about when we were going through COVID, because you see COVID on the back of it. How do I'm able to have systems in place for time management, and time management and safety are correlated because you need to get to the house right away. Because you can go to a home that they're okay, but the next house need help right away. But if you at the house that says that you're okay, that they don't need your help, it throws things off. So I'm just thinking about systems and how to reach our bosses, the residents, in a way that is simple.
Sure.
Director.
Yeah, through the chair, thank you. And we have these, thanks to you, already. And yeah, I think it just completely depends on the circumstances of the public health threat or the threat in general on, what the right notification system is. So we'll prepare for everything, and we appreciate this.
Right. Let's take a look at it later and,
Yeah.
and give me feedback. You're the expert. I just design it. So I'm thinking, because, I was just taught that way as an MBA, to think of systems and processes, time management, the whole 9 yards, and what can I bring to the table? Policy or something like this, because you could take the framework and say, okay, I don't agree with Councilman Conwell on all of it, but it's just a framework.
Absolutely.
It's just like policy. Councilmember Chris Harsh can create policy, but once it hit the table, it's no longer his. It belongs to the administration as well as to all the other council members. And when Chris Harsh, when it's finished with his legislation, it's totally different. And so that's the same way. I'm just throwing it to you. You give me feedback. Kev, this is where I'm at on it. Or even my colleagues. Same thing with a song. You create a song, put it out there, the band members take the song, and they change it. But I just wanted to help.
Yeah, through the chair, thank you.
All right, thank you. And Council Lady.
Thank you so much, Chairman. So I just want to clarify for the folks who are listening that we have the Public Health Department's emergency services, but that we don't have public safety at the table today. So there's a huge component of emergency preparedness for the city that is not present today. So I just wanted to make sure, because I know there's intersections and we've dived into different areas, but I just wanted to say that part out loud. Talking about the sort of epidemiology aspect, I know over the summer there were a lot of news articles about bird flu. I was wondering if you could give maybe the public an update about how we're thinking about that as the Department of Public Health, through the chair.
Sure. So we are lucky to be in a situation where HPAI, or highly pathogenic avian flu, is not so much of a concern for us in an urban setting. While the name is highly pathogenic, it's not highly pathogenic between people. It's highly pathogenic between animals. Pathogenic means ability to spread. So it's not going to spread as quickly like something like COVID would among people, but it is going to spread and is spreading amongst farm animals.
So what's the odds of spreading with human beings? Because sometimes some diseases they say will not spread to us. However, it end up spreading to us.
Yes.
And then we don't know why or how, whatever the case may be.
Yeah, so it has spread to some humans. There are at least 5, I can't remember the exact number off the top of my head, at least 5 cases across the entire country. Now, these people who have gotten sick are, I believe all of them are agricultural workers. So these are people who are spending a lot of time in pretty close proximity to farm animals. So without any of those types of facilities in Cleveland, we don't have as high of a concern. We have had some conversations with our environmental department and our food systems analysts to discuss if that would be a concern for any backyard chickens. If people are purchasing chickens from states where there have been identified flocks that have HPAI, that is something that we're taking into consideration. But generally, our risk in Cleveland is low.
Thank you very much. talking a little bit about foodborne illness, I was unlucky enough to get food poisoning while I was in DC, and there I went through their health department portal. I didn't have to go to the urgent care or anything like that, so there was no sort of medical record of my getting ill, but trust me, I was extremely ill, and it was very clear where I had gotten it from. So I went through the DC Public Health Department portal to like report where I had eaten. That was timed up with when I had gotten sick. And when I did that, I realized I wouldn't actually know how to do that in Cleveland. And so I'm wondering if you can share for the public, because look, people get foodborne illnesses or have suspicions about where they might have gotten it. So how does a member of the public who might not have to end up in urgent care where there is a medical record of the illness, where can they report allegations of foodborne illness to the Department of Public Health through the chair?
So this can actually be reported through our website, through our complaint portal. So that's where you would go to submit complaints of any environmental hazards, but you can also submit food complaints there as well.
Thank you. You want to maybe tell us it's clevelandhealth.org, I believe.
Clevelandhealth.org.
Got it.
And then you scroll to the file a complaint.
Yes, which is under a green section with the title environment.
Okay. And then I'm familiar with this portal because we report a lot of like trash and nuisances through that. But when you click that, there's one of the drop downs in addition to like high grass and weeds
There's food complaints in there as well.
So food complaints is the one that you would
Yes.
do for
Yes.
if you have foodborne illness. Okay. All right. Thank you. My last is more of a comment, which is that I don't envy public health professionals trying to like navigate how we talk about COVID in this day and age, because we've both, we talk about sort of being past the pandemic or sort of over it, and you guys are trying to have people both be aware and also sort of move forward with their lives. But there was some language earlier around like, COVID is not really going to impact most people. Most people are going to be fine. And as somebody who's known many folks who've ended up with long COVID or people who are immunocompromised, who've really had to alter their day-to-day living, I just want to think a little bit about the language we use, saying that for everybody this is over and that hospitalization is the only poor outcome from COVID, because the research about long COVID and the way that it impacts people is become more and more robust by the month and by the year. So I want to take into account the fact that hospitalization might not be the immediate hospitalization in the immediate aftermath of the illness is the only negative outcome. And I think there are lots of people who still have and should have concern. And maybe it would be good as a society if we kind of balance that just a little bit better.
Right, and thank you for bringing that up. It is a tricky balancing act, especially when there's a lot of uncertainty. Trying to communicate that to the public can be challenging. So yes, we do recognize that long COVID can be a severe outcome, which is why we're always encouraging people to stay up to date on your vaccinations, continuing these practices of wearing a mask if you're having symptoms, washing your hands if you've been sick, not being around people who are vulnerable, or isolating if you're able to. But that is an excellent point. Thank you.
And through the chair, I think Liz's messaging is really important, because what we saw from kind of society clamping down too much for fear of the spread of illness is that suicides increased, chronic absenteeism increased, drug overdose deaths increased. So a lot of things were happening from that isolation. So we always have to strike that balance of making sure folks know that they can come back out into the world.
Yeah, absolutely. I mean, and that's exactly it. It's a balance, right? And so at the same time that we can talk about sort of the profound health impacts of isolation, I don't want to avoid what's really been debilitating illness that for a long time was not fully recognized by the medical community, but increasingly is. And I think sort of given that best practice about the ways we're thinking about long COVID as a medical illness, I would like to incorporate that into the language we use when we talk about it publicly.
Let's get to think about when you mentioned, and the council lady mentioned she had what was that? A foodborne illness.
Yeah. Oh, I was sick.
Right. So we have people, because sometimes you can have food, you have cross-contamination. And you have a team that's out there to do prevention of that, with as much as you can do, prevention. And when you mentioned that you don't, I'm trying to look at, you said something is missing. in Cleveland.
No, through the chair, so that happened in Washington DC, just want to note that. That's
Yeah,
where our
Washington
authority
DC.
is.
Right.
And we have the exact same portal reference that Councilwoman referenced to submit complaints here in Cleveland.
And so we have that. Here's the other thing I want to ask you, reaching out to the residents. The director of Department of Aging, I have a group that she talks with all the time, and at the rec centers, she goes different places talking with them. Do we have a emergency preparedness booklet? I know we have one with the previous mayors that we can get out to our residents thinking of risk, and because they need to know, although we're talking about it and you tell me, but I need my residents to know, not just the residents in Ward 9, but everyone else to know about emergency preparedness, dealing with snow, dealing with tornadoes, and those kind of things, because we need to know. And not just the residents in the city of Cleveland, also different companies' employees for emergency preparedness, Doctor.
Yeah, through the chair, I think it's just really important for residents to know that 211 number, obviously 911, and then 311 for our city services. And our group is always happy to come and talk to the residents in Ward 9 and any of our wards, and we regularly do team up with the Department of Aging so that we're working together to reach our seniors.
We do have a connection with the Department of Aging to talk about emergency preparedness and tailor some literature, collateral, handouts, whatever you want to call them, to get to their consumers, their people, the aging population. But I do love a good traveling emergency preparedness roadshow, and I have 2 great big bins full of all kinds of, I call it my bag of tricks, even though they're in bins, that are things that can help you get through an emergency. And I'd be happy to mount up a traveling roadshow. And we are actually in the process of recruiting more people from the health department to create a safety committee that we can have more people then who can do community outreach related to emergency preparedness.
No, well, with that, we could start here at City Hall, teaching, maybe even some, like people like me, as well as my other college council members, emergency preparedness, as well as CPR and first aid. You got to be ready.
Yeah.
You can start at City Hall. We can lead the way by having a program or a project that we teach the mayor, people in the mayor's office, the council office. We teach them, we have a day or whatever, and we're going to teach you CPR, first aid, so we could do prevention. We visit some ward clubs teaching first aid, CPR. You try to get people ready, and then we talk about emergency preparedness, number 1. But number 2, we bring in EMS to
Right.
teach
We
first
don't,
aid
yeah,
and
we don't want to
CPR.
steal their thunder. That's their gig.
Right.
CPR, stop the bleed, AED training, Narcan administration. Those are things that EMS is already training people for, and that's completely free. And all of you are
Right.
available to. I mean, that's an option
We'll
for
reach
all
out
of
to
you.
them, but we need, and I'm not beating up on you,
Are you-
Director, champion the cause.
Sure. Through the chair, so we partnered with Nicole Ward of the Make Them Know Your Name Foundation. She's the mother of Denzel Ward, the football player.
Right,
You know
right,
her,
right,
yeah. So we've been doing all sorts of events together to promote CPR, AED training. And then our team, the health department, is actually leading Narcan training throughout City Hall right now because we're getting that put up. It's already in all of our rec centers. It'll be in City Hall shortly, and the rest of the city buildings to increase Narcan availability and save lives.
So how are you moving on that project? You need any resources, any help to get it out there?
Through the chair, thanks to your legislation, you approved funds coming from the county that support that work.
Okay.
You're doing it. You're already doing it.
Right, I haven't, and I'm
Appreciate
not beating up on you.
No, no. I don't think
I just haven't seen it. Maybe I'm focused on some other stuff.
Yeah.
But we gotta have it even at City Hall.
Through the chair, I think we presented it in April, last April, but now we're doing it. It's up in City Hall, so yeah, you'll be seeing more of it.
Okay, good, good, good. Any other questions before I end it? Because I'll do a sidebar with you, Director, so we can reach out to the county.
Great.
To do that, you ready? And we'll probably need you to come with me. I forgot your name, I'm sorry.
Tracy.
Tracy, we'll have, if Tracy, I'm asking you, I don't talk with, I'm not bad. I never talk with the employees. I always talk with the directors. And the
Totally
directors
fine.
talk with you
I
guys.
will not be offended if you don't want to spend quality time with me.
No, but, so I won't meddle. I don't meddle into the
Right.
departments.
He's my boss.
Right. I talk with the directors or the commissioners.
Right.
And then they talk with the employees or they bring the employees in. That way, it's management, you know. Meddling is not good. So I'll talk with you. We'll go over to the county. We'll look at, try to put some systems in place for the emergency preparedness for the winter.
Great,
We'll do, maybe put together a project team and try to get that to happen.
great.
Sidebar, I talked with Richard Starr, Councilmember Richard Starr. He would be here today. He just had to go to a doctor's appointment.
Yeah.
Sidebar about lead, to reach out to CMHA. And then we're gonna meet, and then they will be at the table on the 14th of October to give us a progress review about their lead issue that we held a hearing on a few months ago. Okay? And if you wanna come with us, I'll talk with Councilmember Richard Starr about it.
Sure.
All right? Any other questions? With that, the Health and Human Service and Arts Committee is adjourned. Thank you.